Hello there. I'm Ryan Chan, CEO and founder of Upkeep. In today's video, we're taking a closer look at healthcare maintenance and the strategies that can enhance your equipment's reliability while cutting costs. We'll be challenging the traditional original equipment manufacturer-guided approach and revealing smarter, data-driven alternatives. So stay with us as we unravel the complexities of this crucial industry and unveil some exciting cost-saving insights. Today, we will explore the world of healthcare maintenance and question if sticking strictly to original equipment manufacturer, or OEM manuals, is indeed the best approach. We'll dissect maintenance in the healthcare sector and suggest some smarter strategies that could save costs while enhancing equipment reliability. The healthcare industry is vital, always pushing the boundaries with advanced medical devices and hospital equipment. Despite these advancements, the approach to maintaining this equipment has remained relatively traditional, heavily relying on the guidelines set by the OEMs. This often involves calendar-based or usage-based maintenance schedules. But is this method really the best? Let's find out. Historically, maintenance strategies have evolved significantly. Back in the 1960s, reactive maintenance was common. Equipment was used until it failed. Then came the era of preventive maintenance, which introduced routine maintenance tasks based on time, not condition, vastly improving reliability. By the 1980s, technology allowed for condition-based maintenance, optimizing resource use, and reducing waste. Fast forward to today, predictive maintenance has taken the stage, using data and sensors to predict the best maintenance times, further enhancing cost-effectiveness. Despite these advancements, the healthcare industry often still clings to traditional preventive maintenance strategies based on OEM recommendations. This can lead to unnecessary maintenance tasks, wasting up to 30% of preventive maintenance costs on equipment that has little impact on business operations. Not doing enough maintenance risks equipment failure and reduced lifespan, but doing too much can also introduce problems that aren't immediately obvious. To combat these inefficiencies, consider a reliability-centered maintenance model, which recognizes that different assets have different failure modes and impacts. This approach helps prioritize tasks that add value, enhancing safety and reliability in a cost-effective manner. Now, let's talk about the Centers for Medicare and Medicaid Services, or CMS. They require healthcare facilities to maintain equipment to ensure safety and quality. However, facilities can adjust their maintenance activities based on risk assessments by qualified personnel, except in specific cases mandated by law, like with medical lasers or brand new equipment without sufficient maintenance history. If a facility decides to deviate from OEM recommendations, they need to develop an alternate equipment management, or AEM, program. This program outlines maintenance, inspection, and testing frequencies and must comply with strict policies. Implementing an AEM program allows facilities to streamline maintenance activities based on evidence and data, making the process both efficient and effective. However, it's crucial to ensure that patient safety remains the top priority. The program should be based on solid data and evidence, and exclusions must be identified, such as imaging devices or new equipment without enough maintenance history. Facilities using computerized maintenance management systems, or CMMS, can leverage their data to develop robust AEM programs. It's also possible to gather data from various sources to build a comprehensive maintenance strategy. Getting started with an AEM strategy involves several key steps. First, understand the relevant regulatory standards and ensure your team knows the organization's objectives. Next, perform an inventory review of all equipment utilizing CMMS and asset management software to include all critical equipment and its functions. Then, analyze system functions and perform a risk assessment to prioritize resource allocation based on the impact on operations and patient safety. Identify and assign the most suitable maintenance strategy for each device, which may include modifying OEM recommended intervals based on the condition of the asset. Finally, assess the effectiveness of your new strategy by collecting and measuring performance indicators and equipment condition baselines. This data helps refine and improve the maintenance processes over time. By adopting a flexible, data-driven approach to maintenance, healthcare facilities can focus resources on high-impact activities, achieving higher reliability and safety without unnecessary expenditures. So, think twice before following OEM manuals to the letter. There might just be a better way to maintain your critical healthcare equipment. Thank you for spending your time with us today. We've explored the world of healthcare maintenance, challenged traditional OEM-guided approaches, and discussed smarter, data-driven strategies. Remember, the best maintenance strategy is one that enhances equipment reliability and cuts costs. If you found this video helpful, please subscribe to our channel for more insights. To learn more about our solutions, visit us at upkeep.com. We look forward to seeing you in our next video. Stay tuned.